Hi, and welcome back to another episode of RPEC on Air, a podcast produced by the Retired Public Employees Council of Washington. I'm your host, Alyssa Brady. I am the Administrative Project Coordinator of RPEC. It's a mouthful. And what we do, we talk about issues related to retirement. We hear stories from our members, and we have special guests, including experts on topics that are of interest to retirees. And so today, I am joined by Tim Smolen, the SHIBA Program Manager. Good morning.
Hey, good morning, Alyssa. Nice to see you or hear you both.
Yeah, good to see you and hear you as well. Tim, why don't you get us going? Tell us a little bit about your role with SHIBA and what
Thank you.
SHIBA is, maybe. I started right off with the acronym, but we should back up a little.
Right. Well, the good news is no one's heard of SHIBA, so they won't be confused when you use the acronym. So,
Yeah,
I mean, it's not really good news that no one's heard of us. That's kind of our job number one.
we're getting there. Yeah.
We're getting there. Yeah. So thank you for having us. We really appreciate that because, connecting with your members is a really big deal for us. We just celebrated Public Service Recognition Week for those of us who are active in state government. And I think I just want to take a second and thank all the people who are currently working in public service or retired from public service. I think, they have a proud legacy, whatever it is they did, supporting state government or local county municipal government programming. Ironically, SHIBA, we've been around for 45 years. We're celebrating our 45-year anniversary this year. And our acronym stands for Statewide Health Insurance Benefits Advisors. We're a free, impartial, confidential service of the Office of Insurance Commissioner. So we align to the mission about consumer protection. And our sort of specialization, as you said at the top of the hour, is really working with retirees on Medicare insurance and related topics to Medicare. So thank you for having us.
Yeah, thanks for joining us. I refer a lot of our members over to SHIBA. Medicare is very complicated, and they have all kinds of questions. There's so many different situations people run into, and I'm like, okay, I haven't heard of this before, and then I learn a little bit more. So it's very complicated, and it's a very good resource to have. Thank you all, and it really hits close to home too. People are very affected by, if they were confused on something and maybe they did something different during their enrollment, and then they go back, they're like, oh my gosh, this is I messed up and now I have to kind of wait, I'm stuck with this. SHIBA is a really important resource, it's volunteer run. Yeah.
It is, yeah, and for me, that's the joy of it. When I started in this job about 3.5 years ago, and for me, it's a bit of a political statement, right? It's like saying Medicare is an entitlement, right? You've earned it by, paying into the Social Security system, right? The Medicare Trust Fund, and it doesn't really feel like an entitlement if you don't know how to use it, right? If you can't really make the best use of your benefit, and it, meaning no disrespect to the agents and brokers out there. To me, my attitude is a bit like, why should you have to pay to get, advice or counsel or direction or even just emotional support? As you said, a lot of people feel like they know what the right thing to do is, but they just need to be reassured that, they haven't missed something
Hmm.
to optimize their benefits. So for me, the fact that it's really run by volunteers is the key to the whole program. The volunteers are the heart and soul of the program. And I can tell you from experience, it's just a remarkably different conversation when a volunteer calls you or you're standing across the table or sitting down having a conversation than when it's a paid professional, right? Because
Mm,
there's no question about ulterior motives. The only reason I'm
right.
here is because I care about you and I want what's best for you, right? So it's
Hmm.
not this complicated fiduciary responsibility, signing forms. It's just like neighbors helping neighbors.
Yeah, they're not going to push anyone towards one specific plan or anything like that. So yeah, that's very important. It can be the medical industry, it can be kind of predatory at times. Sometimes it feels it's complicated by design. So again, we're really glad that this is a resource available. And if someone does need help, if they have questions about Medicare, how can they get in touch with a SHIBA volunteer?
Yeah, thanks for asking. So, one of the challenges of our work, and I think you have this at RPEC as well, is just we're having this growing kind of digital divide, right? And so we take a lot of pride on the fact that we will meet with you locally. So, as you said, most of the work is done by volunteers. Of course, we have paid professional staff that work complex cases and take referrals from the volunteers as well. But really, kind of our bread and butter, so to speak, is that you can arrange to meet with a local SHIBA volunteer near where you live at, and we can have a one-on-one conversation or on the phone or on Zoom. So you can reach us directly on the telephone. We have a live answer service, 1-800-562-6900 is our local number here. It rings 9 hours a day, 5 days a week, except for holidays, of course,
Hmm.
for business hours in state government. And if you call that number, we're going to say, "Hey, Alyssa, where are you calling from? I live in Rochester." Okay, so I'm going to pass your information over to a local volunteer, which in Olympia would be Senior Services for South Sound.
Hmm.
And then they'll get you a call back and either have a phone call with you or, as I say, arrange a personal visit. We also have a very great website presence. So if you're an online person, which more and more people are going that direction, of
Hmm.
course, that would be www.insurance.wa.gov. And we have lots of great resources on our website, including that you can send your question or complaint or fraud referral directly, through a form, fill out a form and push send. We also have live chat on the website, and you can order publications or simply read about Medicare or search for a local education event or counseling session in your local area. So typically you're gonna reach us by the phone or through the website.
Yeah, that's great. So what are some of the things specifically that SHIBA volunteers can help people with?
Yeah, really all kinds of things. Like, you said a second ago, Alyssa, the range of questions is always it's always something different, right? The no 2 days are alike or no two calls are alike because no two people are alike. So I guess the first thing, just for context, right? There's round numbers, 8 million people in Washington state, and 1.5 million are over age 65. And it's the fastest growing part of the population, right?
Mhm.
So in the next decade, we will be 20% going to 25% elderly in Washington state. And so when you
Yeah.
think about the diversity of who those people are, you can imagine that there's a diversity of questions, right?
Mhm.
But I think broadly, mostly where the space that we're working in is a lot of people have questions of the kind of getting started with Medicare, right? And a lot of them relate to retirement, of course, right? But one thing that I would want people to know about Medicare that they don't know is there's actually a really significant group of people who are in Medicare that are under age 65. So generally, we think about Medicare as like insurance for elderly,
Mhm.
um, but and that's true that in the original legislation. But we also, starting in 1972, people who are permanently disabled qualify for Medicare. So
Mhm.
about 15 to 18% of everyone in Medicare is a younger disabled person. So that journey about getting started, whether you're a disabled person or whether you're turning 65, that is very fraught for people. And
Mhm.
for people who are related to RPEC, for instance, a very common question for us is, what about if I want to work past age 65? Am I allowed to do that? Right? Because there's kind of this bogeyman about penalties for late enrollment. Don't miss your
Mhm.
chance. Like you said, don't do the wrong thing and have drama. So we do just a lot of work about getting started, whether you're working past 65 or not, whether you have dependents or not, whether you're eligible to enroll in group insurance or not, and then the rules about switching, right, inside a group or outside of a group, comparing group insurance. So, for instance, we're going to do a lot of work this fall, like we did last fall, with
Mhm.
folks who have HCA PEB insurance, and that portfolio is changing a lot, and people have lots of questions about that. And the questions start with, should I stay with my group or should I go out to the commercial market? Right? I have this conversation every year with my
Mhm.
mother.
Mhm.
I know you say to do this, 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 but I have this friend who has this benefit where she gets a free gym membership, and why shouldn't I go there and get that plan? I'm like,
Mhm.
I'm not saying you shouldn't do that. I'm just saying eyes wide open, right, Fran?
Mhm.
So I don't call her Fran, I call her mom. But
Yeah.
but that journey, right, is a big part of our work. I'd say that the other, if you know broadly, the other significant part of our work then is the annual Medicare open enrollment period, right? That's
Mhm.
your time to switch plans. If you're not in a group plan, then right, you're the October 15 to December 7 Medicare open enrollment period.
Mhm.
Tons, right? Everybody gets a raft of mail and phone calls and text and come to a free breakfast, right? This kind of solicitation.
Mhm.
So that's an exceptional busy time for us. And then there is complaints, right? There is, I'm in and I feel pretty good about it, but it's not working for some reason.
Mhm.
So it can be with the managed care plans, prior authorizations. For original Medicare, it can be covered services.
Mhm.
If for anyone, a very common thing is moving nowadays, right? People are much more mobile. So I want to move to be closer to my grandkids. What happens with my insurance? And then, as I
Mhm.
said, fraud referrals, because unfortunately, fraud is real, and we are the designated Senior Medicare Patrol fraud program. So if you feel like something's not right, there are unfortunately lots and lots of schemes out there. As you said, there is sort of predatory practices,
Mhm.
unfortunately. So we deal with referrals of the kind where we're going to file a complaint with the Medicare agency, or we're going to make a referral to the Office of Inspector General for, essentially criminal prosecution.
Yeah. Yeah, so you'll kind of file that on behalf of the trying to what was the word? Complainant? I used to be in HR and I've already forgotten the word for it. Yeah, the individual that needs help.
Exactly. Yep. We would help you navigate that referral, take your case details, and then pass it along. Yep.
Mhm. Yeah, that's good. That helps a lot because I mean, that can be so overwhelming, like, I don't where do I start? And I just like, I don't even know what to do. Yeah, so that's really helpful. What kind of people, do you have volunteering for Sheba?
Yeah, gosh, all kinds. Again, huge diversity, right? So not to stereotype or profile, but
Yeah, maybe there's a
um,
better way to ask that.
yeah, no, it's a great question, but I think, broadly, I think it's people that like solving problems, right?
Mhm.
The things that other people, like my mother, for instance, find aggravating and frustrating, then they're like excited, like bring it on. This is my next new
Yeah.
thing that I'm going to learn. They're the people that do the Wordle every day in the New York
Uh,
Times, right?
yeah, love Wordle.
Love problem solving. They love
Mhm.
crossword puzzles, and they just love puzzling things out,
Mhm.
sleuthing, I guess. Um, and they're all really motivated, just caring people. A very typical story that we get is, I'll just say you as an example. So I'm Alyssa, and I'm getting ready to retire from a great career, and I was an HR benefits professional, so I thought I understood all this stuff. And then it was time for me to enroll in Medicare, and holy smokes, this is way more complicated than I understood. I don't want someone else to have the same challenging, difficult experience I
Yep.
did, right? So it's a lot of, if I knew then what I know now, and
Mhm.
wanted to kind of give back, right, or pull someone else through that experience, right?
Yeah.
Yeah. So
Yeah.
they're just people that want to stay socially involved. They love socializing with each other. They form a great bond with each other and with their volunteer coordinators. Um, and they just love learning. I mean, I guess that's the other, if there was kind of a short list of things that describe a typical volunteer, it's lifelong learners. So
Mhm.
where for you and me, it might be like, oh my gosh, it's changing again. They're like, I want to know everything about the changes so I can tell someone else so they don't have a problem with it, right? They have that kind of orientation of
Mhm.
yeah, just I don't know what the analogy would be in the job world, but they're the navigators. They're going to
Mhm.
keep you. They're the park rangers, right, of the world. They're going to like, don't go there. That we saw a bear yesterday, so we're going on a
Mhm.
different path today.
Mhm.
Kind of thing. And
Yeah.
just the disposition. They love their work. I mean, if you get through what we call basic training, right? And if you have a good experience and you make a social connection, very, very common for people to be 3, 5, 10, 20-year volunteers with us.
Yeah, yeah, it sounds very fulfilling, and I know our members, because again, I said that this is something that hits very close to home. They do have that passion to help others, so that other people don't go through what they have gone through. And it helps too to just know. I'm sure for them too. Like I've learned a lot about Medicare now, so I can kind of use that. Whenever open enrollment comes, for myself.
Yeah, and I think it's for a lot of people, we're kind of living in the age of misinformation and
Yeah.
disinformation and deep fake, right? All of this kind of
Yeah.
AI terminology that I'm not super familiar with, but
Yeah, and
there's
it's always
something very
changing.
satisfying about saying, "Oh, it's Alyssa. I know her. She's part of WEA retired, or she's part of RPEC, or I know her because we're community volunteers together with the library."
Mhm.
Again, I think almost all of our volunteers do something else besides this, but they generally say this is their favorite volunteer assignment. So it's a
Yeah.
very different kind of conversation when you're talking to somebody who just wants to take the time and sit with you, or as I say, be on the phone or on Zoom. Um, you know, we often typically appointments are 20, 30, 40 minutes long while people just unpack their story and make sure
Mhm.
that they're understood. And we're here to hear you, we're here to see you, we're here to help you. Take as much time as you need so that you walk away, both with the technical information, but also just let's let some of the anxiety out of this. It's very sad, Alyssa, it's very common that we'll talk to people. We have an appointment Tuesday morning at 10 o'clock over at the library, and I didn't sleep last night because I've been carrying this anxiety and this worry. And thank you for seeing. And we,
Yeah.
we don't want people to walk around, holding on to all of that fearfulness and anxiety.
Mhm.
Um, so we want you to be kind of right on the facts, but we also just want you to like let go of that and don't be preoccupied with worrying about it, right?
Mhm. Yeah. So you had mentioned previously, going through the basic training period. So you all will provide training for everyone as far as even learning about Medicare, right? They don't have to necessarily be an expert on it going into it. Like you can't volunteer. You don't know anything about this. You didn't pass the test. Like, come on, get out of here. It's
Right.
nothing like that.
No, it's like no barriers to getting started.
Hmm.
There's no prerequisites at all. I shouldn't say that. Let me qualify that. The only prerequisite we have is that we, of course, conflict of interest, right? So
Mm.
if you are a person who is a licensed agent or broker, you would have to give up your, license in order
Hmm.
to be a SHIBA volunteer, because again, we very much have to um, be unbiased, right?
Hmm.
Impartial, confidential, free. That's kind of our ethic, right? As a program,
Right.
it's a free service of the insurance commissioner's office. So I shouldn't say there's no pre-qualification. You cannot be a licensed insurance agent. Past that,
Hmm.
there's nothing, and we provide all of the training. So regardless whether you know a lot about Medicare or you don't know anything about Medicare, we provide both instructor-led and online coursework. We provide continuing education. We'll attach you to a mentor who can do peer coaching with you. So there's lots of support for people all along the journey. So if you're as experienced as I was a volunteer like this in Illinois, and I moved out here to be closer to my grandkids, or I was the guy who excavated graves because I worked for the cemetery district and I don't know anything about insurance or Medicare. Everyone is welcome.
Yeah, good. So, are there different roles that the volunteers play, or are they strictly just, advisors over the phone, or whatever the communication is, or are there kind of other things that are behind the scenes in a way?
Yeah, thank you for asking. Absolutely, there is a lot of different kinds of roles. Of course, today I have been focused on what we call volunteer advisor, right? The person who will sit with you and have the conversation. But we have volunteers who their specialty is public presentations. So they'll provide presentations online or in person. We have people who do the scheduling
Hmm.
for other volunteers. So to just make sure that people are well prepared and they show up. You'll be familiar with this, like from your dentist's office, right? You get the
Hmm.
reminder call a day ahead of time. So we have volunteers who manage the scheduling and the referrals. Of course, there's paperwork. I mean, it's
Mm.
virtual paperwork, right? But
Hmm.
we do have to, keep faith for the work we're doing. what I tell people is you're a volunteer, but you are a professional. You're just an unpaid
Hmm.
professional person, right? So effectively, it's like a job to us. We take it that seriously, and the volunteers do. So there's paperwork, right? You fill out
Hmm.
a contact record form after you've had a meeting with a person or done a presentation or helped someone complete an application. So we have people who just like to do data entry or do quality assurance for data entry, and then administrative work.
Hmm.
They might work outreach, for instance. We'll be at lots of the benefits fairs that HCA PEB will sponsor this year. So you might be, we call tabling, right? You might like to come sort of stand behind the table and help people with outreach and answer basic questions and connect them to our services. So yeah, there's a broad range of volunteer opportunities for people.
Yeah, that's good. And it sounds like you had mentioned, you can communicate with SHIBA volunteers over the phone. You can go in person. So it seems very much based on their skill set to what they're comfortable with. You don't necessarily have to be tech savvy in order to be a volunteer as well. And I mean, you all would provide training for that for folks who want to get into that maybe, but they're new to it.
Yes, absolutely, for sure. So yeah, everything from sort of like basic, computer skills all the way to using our own, the systems that we use as part of the network of programs like ours. Um, we started with the acronym. Our program is called SHIBA, and we have our 45th anniversary this year. We were the first program like this, but now there's programs like this in all of the states and 4 territories. So we're one of 54. Broadly, these are called SHIP programs, Senior Health Insurance Assistance Programs. So when you get your Medicare and You handbook in the mail in the fall, in the back of the book, there's a list of all of the programs like ours. So if you're helping someone who is in a different state, then you could just hop online if you're an online person or call 1-800 Medicare and ask for your senior health insurance assistance program or use the SHIP locator online. But
Hmm.
yeah, absolutely. We provide, as I said, the world is on technology, and we're constantly working kind of both sides of the fence, if you will, right? So we have volunteers who are very sophisticated with technology, and so a specialization for them, Alyssa, like you said, might be, what I want to do is help people who don't have computer technology work that Medicare Plan Finder tool. So I want to just get on the phone, get the list of the drugs from them, or get it from another volunteer, put it in, run the options, and send it to them. And subsequently, they can then have that, in-depth kind of analysis conversation. But
Yeah.
people with no technology, still plenty of room for them to plug in and be helpful.
Yeah. All right. Well, let's say that, if someone were to want to become a SHIBA volunteer, what would that entail and who do they need to talk to?
Yeah, so we do contract with not-for-profit organizations around the state to do what I affectionately call care and feeding of the volunteers.
Mhm.
So they employ a person to be a volunteer coordinator. So just as an example, if you are retiring to swim, right? People like to retire to swim because it doesn't rain there every day like it does
Mhm.
here in Olympia, where you and
Mhm.
I are calling from. Then you could call the 1-800-562-6900 number or go to our website, www.insurance.wa.gov, and then say, hey, I'm interested in being a SHIBA volunteer. Then we're going to ask you where you're calling from or where you're writing from. I live in Squim. Okay, so then our local partner in the Squim area is the Olympic Area Agency on Aging. We call them O3A.
Mhm.
And we would say, okay, Eva Bennett is our dynamic volunteer coordinator in Squim. We're going to have her reach out to you, complete a volunteer application. She'll do an interview conversation with you, make sure you understand the expectations. And as you said, what the training is, the support you're going to get from us. We do a criminal background check, of course, on it's a national criminal background check on all the volunteers because we have to, safeguard the public that we're working with. And
Mhm.
then we would then initiate you into what we call basic training programs. So this is your formal beginning of formal education. We start with instructor led coursework. So professional staff in our team do that training with you. And then there's ongoing monthly continuing education programming. We have lots and lots of options for self-study, including courses that our agency produces, as well as ones that are sponsored by the Medicare agency, as well as ones that are sponsored by partner organizations. So ample opportunities for self-study and learning, webinar style. And then, as I said, we will also connect you to a peer mentor or a coach to help you. So it's kind of like you'll get to watch them and listen to them and then practice together and get some guided feedback, developmental feedback, and then you're ready to kind of fledge and work independently in the community. And that arc depends a lot upon motivation and availability and what the role is that you're interested in doing. But
Mhm.
generally, I'd say for a volunteer advisor, probably about 12 months if you're going to be a full service volunteer advisor. For some of those other specialty roles, probably you're up and going in a couple of months.
Mhm. Okay, yeah. Yeah, and so we've got open enrollment coming up soon in a few months. I mean, I'm sure you need some more volunteers going into that to help support. So what's a good time frame for someone to get started with the basic training for Sheba so that they can be prepared in time for open enrollment to help other people?
Yeah, thank you. Well, you and I are recording this program the first week of June. So really, June or July probably is a great, I mean, of course, it's summer vacation and it's the nice time and people are
Yeah.
traveling and gardening. But, starting now, in June, July, August would give people 30, 60, 90 days to ramp up. Uh, we'll have some more programming with RPAC. I'll, be working with Lori, your executive director, and Mac Rashong, your healthcare committee, to talk about what's happening for folks that are in the HCA PEB system, starting with they will be moving their open enrollment period this year, which will be a communications challenge, right?
Yeah,
Um,
yep.
but their open enrollment will start the end of October. And so really, we'd be kind of intensively training people across September, October.
Mhm.
Um, and then for beneficiaries who are in other group sponsored plans, right? Other political subdivisions, states, counties, municipal government, or people
Mhm.
who are not in a group plan, then that would be the annual Medicare open enrollment period, October 15, December 7.
Mhm.
So, really starting soon, but intensively training September, October.
Yeah. Okay. Good to know. Yeah. So, everybody listening, if you want to volunteer, I encourage you to do so. It sounds really great. Actually, I think I would be interested in doing that.
We would love
At
to
some
have
point,
you.
I would love to know more about Medicare. Like I was saying. The more and more I hear of people's different situations or just news that comes out, I'm like, okay, well, there's something I didn't know, and like kind of
Mhm.
over my head, it seems like that knowledge kind of translates into just other insurance plans in general.
That's a great insight. I think that it's like the gateway, right? That when you learn Medicare insurance, it kind of like your mind opens up to say, oh, now I have a better insight into how my house insurance or car insurance or life insurance, like it's like the tumblers kind of fall into place a little bit, right?
Mhm. Mhm.
Um, and I think that, generally, what we're hoping, again, thanks so much, Alyssa, for talking with us. But, even just, my expression for this is just like raising the level of literacy, right? So if you just happen to be in line at the grocery store and you were hearing some older person kvetch about open enrollment is coming and there's
I
this
have
rash
actually
of
had that happen.
advertising and you're kind of like an interested bystander, but you're like, oh my gosh, I wish I could help you, but I don't know how. Well, now
Mhm.
you just send them to us, right? Or if you
Yeah.
want to go one step further and just get kind of a primer, so if what you overhear is like, there's something about prescription drug plans and out of pocket limits, and I don't really understand what it is. Like,
Mhm.
oh, I know that there's this program that'll
Yeah,
help
sorry
you.
for being nosy, but let me help you. Yeah, yeah, that's great. Well, I encourage our members to, reach out and start volunteering for Sheba. And again, if you all have questions about Medicare, then know that this is a resource that's available to you. So thank you, Tim, so much. Is there anything else that you'd like to add or promote? Anything exciting coming up here soon?
No, I just want to thank you so much for making time for us this morning, Alyssa. And again, just very grateful for the folks who are your audience for their service, whether they're actively working or retired. Public service really is a calling, and whether you do it short term or as a career, it does make a meaningful difference. And I think at a time when people's trust in government is very low, and people are
Mhm.
skeptical about the value they're getting, I think it's just important to acknowledge that a lot of
Yeah.
people are working really hard to sustain the systems that we all depend upon, but maybe we underappreciate. So I just want you to know, as the listening audience, that we appreciate you.
Yeah, thank you. And thank you everybody for tuning in. This is RPEC on air. You can visit our website at www.rpecwa.org. That's RPECWA.org. And again, the website for SHIBA is www.insurance.wa.gov/SHIBA, SHIBA, right?
Yes, perfect.
Okay, cool. Well, thanks again, Tim. We'll be in touch, and I hope after this you get a flood of folks wanting to volunteer. All
Thank you.
right.
Thank you so
Y-
much, Alyssa.
Of
Really
course.
appreciate the time.
Yeah. I forgot what my follow-up question is. I'm gonna edit this out, but oh, okay. All right, here we go.